you need to take care of your children's teeth. Today, we're going to be talking about infant and toddler tooth care. So we're going to go over a little bit of the basics of what you can do from birth until the time they actually start seeing the dentist, and then when to bring them, and some tips on how to prepare them as well as you as the parents for that first dental experience. So let's talk a little bit about taking care of their teeth from the beginning. So we have a slogan here that basically just says it doesn't really matter how you take care of their teeth as long as you take care of them from the beginning. And while this is true, we're going to give you the specifics of what that means. So first of all, before their teeth even start to come in, you're going to want to make sure that you're cleaning their gums with a clean, damp cloth after all feedings. So this is bottle or breastfeeding. Just make sure that you're wiping their gums off, just starting to create a healthy environment for those teeth to come in. Then, to prevent what we call it baby bottle tooth decay, we want to make sure that you're not giving your child milk, juice, or sweetened liquid at bedtime or at nap time. And then to make sure after all feedings with the bottle or breastfeeding again that you're wiping down their teeth with a cloth. Now, once they get to the age where they start to have these teeth in there, you're going to start prepping them with an actual toothbrush. So toothbrushes come in all sizes. So they come starting with an infant size toothbrush all the way up to adult. So while they're still in the infant stage, you're going to use the infant size toothbrush. Most of these have a really, really small head on them. They usually have a Winnie the Pooh or a little bear or Mickey Mouse on them. And you're going to use that with a pea-sized amount of fluoridated toothpaste. And this is just like not even the pea size, like smeared, like just a little bit of amount. And then you can upgrade as they get older to the pea size and then a regular amount. So you're going to do a smear of fluoridated toothpaste, infants and toddlers. And then once they turn around 2.5, 3 years old, you can use a pea size. And then from there, you can graduate up. Just again, remember, it's not really the amount of toothpaste that matters. It's really about their brushing technique. So just remember that and teach your kids to use the proper amount of toothpaste. And then one of the biggest things that we have is you're going to need to be helping your child. So you may have a 4-year-old at home that wants to do everything by themselves, and that's perfectly fine to let them practice and have fun brushing their teeth. We want it to be fun for them. But we also recommend that as the parent, that you're helping with brushing to anywhere between 7 to 8 years old. I always say that I still help my kids sometimes, or I at least get in there once or twice a week and make sure that they're brushing all the areas that need it. And my son's about to turn 13. But I'm just that mom. So it's kind of up to you. But as far as the dentist, we recommend that you're helping your child until about age 7 or 8. And then we want to make sure the other thing that's really important that a lot of parents don't think about is limiting foods and treats that increase tooth decay. So this is going to be anything hard or sticky, any type of fruit roll-ups, fruit snacks, sweetened drinks, and juice. You can have fruit, but just not juice. A lot of the fiber in fruit tends to actually scrape the teeth clean. So that's really good. But juice just exposes the teeth to sugar. So we want to make sure that you're able to give them the fruits and the vitamins and all that stuff that they need, but just limit the amount of juice that they're having, because even 100% juice, we're doing really well by giving them that, but it's also full of sugar. So just be mindful of that. If they are having those sweet treats, make sure that they're brushing and flossing afterwards. And then we want to talk a little bit about vitamins. A lot of them come in the gummy flavors now. So they come in a gummy form. And kids you're doing the right thing. You're a parent, you're giving them their vitamins as they need every day. But what is happening is they're sticky. And so they're sticking to their teeth all day. So if you're like, here, take your gummy vitamins, and you're running out the door to school, then it's possible that gummy stuff is just staying behind in between their teeth. It's collecting all the bacteria, all the food, everything they're eating all day. And then they're coming home, and so it's been sitting on their teeth the whole time. So just be mindful of that if you are using a gummy vitamin, to make sure they're brushing and flossing after they have that. All right. So those are just a few tips you could do to kind of take care of their teeth anytime from the time they're born. These will all include up till around age 3 or 4. Then the next question we always get is, when should I bring my child for their first dental visit? And actually, we have a professional group that can answer that question for us. We go by the guidelines of the American Academy of Pediatric Dentistry, and they recommend that all children see the dentist by their first birthday. So we want to make sure that you're bringing them in by 12 months or at least within 6 months of their first tooth. And a lot of people say, like, why so early? Why should we be doing that? But as soon as your baby has teeth, he or she can definitely get cavities. And so being proactive about your child's dental health today can help his or her smile stay healthy for life. So that is something that's very important to us as a dental practice, to continue to educate on that fact. So tell your friends who are just having babies to make sure that they're scheduling their dental visits. Make sure as you're having your own new children that you're bringing them in with the kids. The question always comes after that is kind of, why are you wanting to see my 1-year-old? Like, I don't understand. So we're going to talk a little bit about what's going to happen during that visit so you can kind of know that. Now, again, this is only going to apply to an infant or a 1.5-year-old up to 2 years old for this type of appointment that I'm going to describe. Obviously, if you're watching us and your child is 5, 6 years old and they've never been to the dentist, that is perfectly fine. We are here for you. We will get them in for their first dental visit and get them all set up. There is no problem with calling us now and getting it started. It's better to get it done now than waiting even longer to come in. I actually have a friend that I know who we work with her a lot, especially in the dental space. And she just has a lot of fear behind that. So we're going to talk about that a little bit too later on this video. So first, we want to make sure that you understand what's going to happen during that first dental visit. Now, remember, this is ages 2 and under. You should expect for that first appointment to be short and semi-informal. We'll greet you. We'll make sure you have all the proper paperwork and things like that. But this appointment normally consists of the child visiting with the dentist for an exam and us placing fluoride only. So the chances are the dentist will talk to you about a good oral hygiene habits and give you the chance to ask any questions that you may have about your child. And this is going to include toddler teething, thumb sucking, and tooth-friendly foods, and anything else that pertains to your child's oral health. You, as the parent, may also want to bring a list of your questions to the appointment so that you can remember them when you get the dentist's attention. So the biggest thing about that is, for some children, this appointment just is not like their favorite in the whole world. We try to make it a great experience by providing an environment that will eliminate some of that fear. But a lot of times it's weird for them, right? Like, they're laying down on a bench and having to have their teeth brushed, and they don't really understand the lay down part. So we do recommend practicing with that ahead of time. So we're going to go over how you can prepare your child. So we're going to go over a list of some fun things you can do with your child, and then we're going to have a quick parent prep for what you can do as the parent, okay, to make that appointment go more smoothly. And these tips that we're going to talk about for the kid would apply to any child pretty much at any age for their first dental appointment. So number one, we have to read up and role play. So read picture books about visiting the dentist. Encourage your toddler to play dentist with a stuffed animal or doll. Make sure that they're pretending to open their mouth wide, looking inside, and even brushing their teeth. I've seen videos and pictures even from some of our patients where they take their doll or their teddy bear, they lay them down on the couch, and they're actually using a toothbrush to brush their teeth. So I think this part is super fun to show them that they're actually going to lay down on the bench. Almost all of our benches in our office are just already laid down benches. They don't retract back, so we don't have to worry about that piece of the visit of the seat going back. They'll just lay down straight. So if you want to practice that, you can just lay them on the couch, on the coffee table, on the kitchen table, and just show them how that visit will go. You could also use this same format with your child. So if you wanted to kind of talk about that with your child, then you could show them you're going to lay back, they're going to brush your teeth, and do a few teeth brushings that way, and just kind of show them how it's going to go. One of the other most important things is to make sure you're using positive language. So explain to your child that a dentist is a doctor who helps build healthy, strong teeth, but avoid getting into too much technical detail about the visit, which may confuse them more than it actually clears anything up. And then the other thing is, come prepared. Bring along any comfort toys or distractions for the waiting room and the dental chair. So I would say if they're using a doll or a teddy bear, or you had a favorite book or something like that that you were using to prep them for this type of appointment, that you bring that with you so that they can show the dentist what they've been doing. And that a lot of times they'll be so excited about doing the show and tell version of it that it'll kind of take their mind off what's actually going to be happening during that visit. The other thing is, you could plan a treat. Something as simple as a trip to the playground after the dentist can help your toddler stay focused on the positive. And then staying relaxed. Your own stress or anxiety about the dentist may be more noticeable than you think, especially for a perceptive and sensitive toddler. If you're cheerful and calm, you set the tone for your child to be too. So we see that a lot. As adults, we know that when we were going to the dentist, it wasn't fun like this. There weren't iPads everywhere and TVs everywhere. And there weren't a lot of actual trained pediatric dentists when we were growing up. So now dentists are going those extra 2 years, getting extra education and extra training to take care of kids specifically. And this is paying off in dividends as far as the fact that they are able to really adhere to your child's needs and be able to take care of some of those special and sensitive situations that may arise. And then at last but not least, for your child, be a good cheerleader. Congratulate your kiddo whenever you can, and try to be supportive and not critical. If your child has a hard time cooperating, and remember, even if he kicks and screams the whole time, it's nothing an experienced pediatric dentist has not seen before. So as an office, our dentists and our staff are completely used to this. You can have a kid that comes in for their first dental visit. They're doing amazing. They do great. And then they come back for that second visit and they're like, nope, don't want to do that again. And then you have the the child who comes for their visit and they don't want to leave. They're holding on to the doors like, Mom, I want to stay. So it's going to vary by child, and we completely understand that. And that's why we take the time to make sure that our doctors stay on top of their continuing education for the newest features that we can do to make your child more comfortable. Our staff is trained regularly for that, and our new staff members are also trained to make sure that we're eliminating that future fear. All right, now for you parents. So there are a few steps that you can do ahead of time to make sure that your child's first dental visit goes smoothly. Now, first of all, we want to make sure that you have all the necessary tools and everything that you need. So at our office, we offer electronic forms. Having these completed beforehand is helpful to you as the parent and to our doctors and staff. So we would want to know of any health conditions, any type of, fun things you want us to know about your child, seeing, if for some reason they haven't been seen in our practice before, it kind of just gives us an idea of what we'll be looking for. And then we also want to make sure that you make a list of questions. I mentioned that in the child part, but we want to reinforce that to say, put them in your phone, have them ready, because if your child for some reason ends up being on the more uncooperative side, you may not remember all your questions. So go ahead and have those with you, either on paper or in your phone, and we'll be happy to answer those. The next set of advice is don't schedule an appointment during nap time. Instead, pick a time your child is usually well rested and cooperative. As our office as a whole, we do make exceptions to this. We try to see kids who are not school age in the morning and then school age and above in the evening or in the afternoon into the evening. And that is because of this specific reason, that we feel like they're at their best in the mornings when they've just woke up, before they've gotten into lunchtime and nap time and had to deal with the day, right? So we don't want to have any added stress. So that's why sometimes you'll hear us say, well, your child is at the age where we would love to see them in the morning. And that is one of the reasons why we do that. And then make sure your child has had a light meal and brushes their teeth before their appointment so they won't be hungry during their visit. Save snacks for after the visit so that they aren't on your child's teeth during the exam. Especially right now during COVID, our toothbrushing stations are shut down and they've been transformed into hand washing stations. So everyone should be brushing their teeth ahead of any appointment in our practice anyway, but this is just a really good thing to try to practice because you may not always have time to get them in early enough to get their teeth brushed prior to the appointment. And then last but not least, think of the appointment as a happy and fun experience. If your child cries a little